Heart attacks are a leading killer of men and women in Canada. Each year, about 70,000 people have a heart attack, and about 1/3 will die. A heart attack occurs when blood flow to a section of your heart muscle is blocked by a narrowed heart vessel. If blood flow is not restored quickly, this part of the heart muscle begins to die.
Fortunately, you can take steps to protect your heart and your life. It is important to seek medical care as soon as you experience symptoms of a heart attack. Quick treatment can save lives.
Call 911 right away if you experience any of the following symptoms: chest pain or discomfort that lasts for more than a few minutes or goes away and comes back, upper body discomfort in one or both arms, neck, jaw, or upper part of stomach, shortness of breath, nausea or vomiting, sweating or feeling cool or clammy. After a heart attack, lifestyle changes can be made to reduce your risk of having another one. These changes include: stop smoking, reduce your alcohol intake, lower high blood pressure, reduce high blood cholesterol, aim for a healthy body weight, be physically active each day, manage diabetes, and manage stress. After your heart attack, your doctor may treat you with the following medications: blood thinners, also known as antiplatelets. Examples of these drugs are ASA, also known as aspirin, clopidogrel, also known as Plavix, prasugrel, also known as Effient, or ticagrelor, also known as Brilinta. These drugs stop platelets from clumping together and prevent clots from forming. This may reduce the risk of heart attack and stroke. Do not stop this drug without telling your doctor. Cholesterol-lowering agents. Examples of these drugs are atorvastatin, also known as Lipitor, rosuvastatin, also known as Crestor. These drugs lower cholesterol. Over time, they may decrease the blockage in your arteries. ACE inhibitors and beta-blockers. Examples of ACE inhibitors are ramipril, also known as Altace, or perindopril, also known as Coversil. Some beta-blockers include Metoprolol or Bisoprolol. These drugs help relax blood vessels. They also help lower blood pressure, which reduces workload on the heart. Nitroglycerin. This drug widens your blood vessels, which allows more blood flow to your heart. This will stop chest pain. When you have chest pain, take only one spray at a time under your tongue. Repeat every 5 minutes for a total of 3 sprays. If your chest pain or symptoms are still present, call 911. Do not drive yourself to the hospital, and do not have someone drive you. Wait for the ambulance, as they can treat you if your heart stops on the way to the hospital. Stronger blood thinner. Examples of this drug are warfarin or Coumadin. If your doctor feels that your heart muscle and blood flow is weak, you may need this drug. It will be given for a period of 3 months. You will need a blood test, called an INR, 1 to 2 times a week while on this medication. The goal is to have blood that is 2 to 3 times thinner than normal. Often, the dose will be changed by your doctor based on the lab tests. It is vital to take the drugs that the doctor has ordered for you. If you have side effects from a drug, then contact your doctor before you stop taking it. Over-the-counter drugs, herbal therapies, and vitamins can interact with the drugs you have been prescribed, so make sure you share the list of drugs you take with your doctor. You should also carry a list of your drugs with you at all times. Once you go home, you will be able to do most of the things you did before your heart attack. You will be told to start walking soon after you return home. You can increase the time and speed of your walks as the weeks pass. In the first 1 to 3 weeks, you can do light housework, slowly climb 1 to 2 flights of stairs, and lift up to 5 pounds. At weeks 3 to 6, you can garden, grocery shop, dance slowly, and lift up to 10 pounds. Other activities like cycling at medium speed, playing table tennis, or 5-pin bowling can also be done. After 6 weeks, you can resume all normal levels of activity, such as walking at a brisk pace, swimming, cycling, and skating. Keep in mind to go at your own pace and rest. You can lift or carry up to 20 pounds. For golfers, start with 9 holes and play during the cooler parts of the day in the summer months. Use a cart to carry your clubs. Use caution with the following: very hot or very cold water, lifting heavy weights, pushing or pulling actions that cause you to hold your breath, working for long periods with your arms above your head, snow shoveling, or activity after a meal. It is normal to feel anxious about sexual activity after your heart attack. Some people worry that sex may bring on another heart attack, but in fact, this is very rare. If you can easily walk up 2 flights of stairs or walk briskly, your heart can meet the needs of sexual activity. Most people can have sex within 2 to 3 weeks after going home. Men may find that some drugs make it difficult to have or keep an erection. Talk to your doctor about any questions you may have. If you worked before your heart attack, you can usually go back to the same job within 2 to 6 weeks. How soon you can return depends on your symptoms, how you feel, and the physical demands or stress of your job. Some people return to work on a part-time basis at first and then work up to full-time hours. The type of heart attack you had will determine when you are able to drive again. This is often anywhere from 1 to 4 weeks. Talk to your doctor about when it will be safe for you to drive again. People who earn a living by driving, such as truck drivers, are usually not able to drive for work purposes for at least 3 months. This waiting time may vary. The Ministry of Transportation will want information from your doctor if and when your commercial license is reinstated. Talk to your doctor and check with your airline before you plan a trip. Most people can travel 4 to 6 weeks after their heart attack. Most insurance companies will not give out-of-province or country medical insurance earlier than 90 days after a heart attack. Each airline also has its own policy for flying people after they have had a heart attack. Cardiac rehabilitation can be a key part of your healing. The Heart and Stroke Foundation of Canada advises you to start a rehabilitation program within 30 days of a heart attack. This can reduce your chance of having another heart attack and can also decrease your risk of fatality by 20 to 30%. St. Mary's General Hospital has a cardiac rehabilitation program. This program is free for the first 6 months. These programs help you with exercise, proper medication procedures, and quitting smoking. They also deal with anxiety and depression that can follow a heart attack. If you are not from this area, our staff will refer you to a cardiac rehab center close to your home. We hope you and your family have found this webcast helpful as you recover from your heart attack. If you have any questions, please ask our staff. If you would like to watch this again, you can log on to our website at www.smgh.ca.
Thank you, and good luck on your road to recovery.